Hi guys, welcome to my YouTube channel. This is Mishi Nekesa and our channel is Mindful Mosaic. So today we are going to discuss about decriminalization of attempted suicide. There is a judgment that was done last week by Justice Lawrence Mugambi, which made attempted suicide not to be unconstitutional. According to section 226 of our constitution, that is of the penal code, it used to criminalize attempted suicide. But right now, according to the judgment that was made last week, those who have attempted suicide will not be criminalized, but will be perceived as people who are sick and need to be treated or need to get some care. So that's a big moment. It's a very big move in the mental health space, and it lays a very good foundation where people living with mental illnesses are not subjected to prejudice and punitive measures, but instead they receive medical attention geared towards their treatment, rehabilitation, and even restoration or reintegration back to the society. So what do we mean by this? Initially, people who are attempting to take their lives were being taken as it was like you are treated as someone who was stealing or someone who was committing murder. So it was unlawful, and you could go in front of a judge and be charged with a case of attempted suicide, which was not okay in our country. But right now in our country, people who are living with mental illness want to have achieved something, because the Human Rights Commission, the Kenyan one, it was trying to fight against decriminalization of attempted suicide, because we were looking at people who are trying to take their own lives as people who have gone through a lot. That is, maybe mentally they are not okay. Two, maybe someone is depressed na amefikia ile stage yenye anaona life yao ni reason ya life, na si eti ni kwa kutaka kwake. It's because someone is sick at that time, and even the judgment or decision making is questionable. So it's also a sign that someone is not okay. So instead of taking them to a court now for them to be charged with a case, they are supposed to be taken to hospital to seek treatment, or to see a psychiatrist, or to see a psychologist, to go through therapy, so that mtu ajue ya kwamba whatever they are going through is something which is just for that time. It's not that it is for the rest of their life. Once mtu amepewa madawa, anaweza akarudi akakuwa sawa. So the World Health Organization had ranked Kenya, or has ranked Kenya, as the 6th African country with the highest levels of depression. This is with a number of 1.9 million cases which have been diagnosed and to be suffering from depression. You see, that's a very high number. And so most of these people who are going through depression and other mental illnesses, sometimes even bipolar mood disorder and some other mental illnesses, watu hufika ile point yenye mtu anaona I'm of no use to this society. So mtu anafika point then anaona it's better hata nijitoe uhai. Na it's not that it's within their limit or within their judgment, yani si kwa uwezo wao. It's not that someone has control over what is going to happen. It's just that inakupata, na ikikufikia hiyo time, the people who are close to you are supposed to they're supposed to know that you're not okay at that time, and if they have gotten you and you are trying or attempting to take your own life, wakupeleke hospitali na upewe antidepressants, upewe dawa za bipolar mood disorder ama hizo disorders zingine, na at least urudi ukwe stable kwa mind, urelax, upewe na madawa zinaweza zikakufanya ukarelax kwa akili, so that hizi mawazo mingi, because at that time there is a lot of things inside someone's head, and because they're sick, they're supposed not to be treated. So 1.9 million, that's a very large number, and you know these are just the few wenye wamejitokeza wakaenda wakakuwa diagnosed ya kwamba wako na depression, but there are those who due to stigma wamefungiwa ndani ya nyumba. They cannot even come out to speak about the issues they are going through, about how they feel, and even seek the medical attention that needs to be given to them. So mtu anaibaki amejifungia because hajui itachukuliwa aje watu wakijua yeye ni mgonjwa. So despite these numbers, the state despite these high numbers and statistics, the criminalization of attempted suicide deterred individuals from seeking help, exacerbating the stigma surrounding mental health and undermining the efforts to reduce suicidal rates. Yeah, you see, these numbers that you're talking about, the 1.9 million, these are just a few zenye zimekuwa diagnosed in hospitals, but kuna other numbers wenye hawaja seek help, they're still in the cocoon, tuseme in the hidden. Some unajua sometimes ukiwa mgonjwa na mtu ajue ni mental illness, sometimes they lock you up, so kuna hiyo kuwa locked up, and so it undermines the efforts to help people who are thinking they can take their own lives. Because if you're sick of malaria today and you're not going to be treated, upewe madawa umeze so that it can kill the malaria parasites within your body zenye zimezaana huko ndani. So you see, hiyo malaria the plasmodium itazidi kuzaana huko ndani, alafu wakati itazidi, so when you go seek treatment, sometimes ita fail or it might be late and someone passes on. So some signs of depression zinaweza zikakuwa mingi zikaonekana, and because people fear ya kwamba watasemekana wako na mtu mwenye kichwa yake imeharibika ama ako depressed, watashangaa mbona haezi akamanage the situation, because you know how I manage a situation is different from the next person, how a next person manages a situation. I might be me, maybe kitu ikitokea naweza nikaongea and it comes out and it be okay. Na maybe I have a sister who keeps it within themselves, or a brother or a friend who keeps it within themselves. So hiyo kutotoka kwenda kuongea sometimes inaweza ikakuwekea ukakuwa na msongamano wa mawazo, na wakati unakuwa na msongamano wa mawazo hujui kule ambapo itakufikisha. So kuna wale ambao inawafikisha ile point yenye mtu anaona hastahili, hafai kuwa katika hii dunia, ama mambo yamezidi mpaka anaona ni heri hata ajitoe uhai. So asipoenda aonekane kwa daktari, anafikia hii wakati ya kujitoa uhai. Okay, so does decriminalization of attempted suicide solve our issues in mental health fully? As for me, no, because we still have a lot that needs to be done so that decriminalization of suicide, it's a step, yes, but it does not solve the mental health crisis in Kenya and even in the whole world. But as of now, we're talking about Kenya. So what needs to be done? One, in my research, I thought we should adopt comprehensive approach that leads to meaningful change. For example, in 2021, the Ministry of Health launched a very ambitious suicide prevention strategy towards expanding access to mental health services. So we need to have an accessible and safe space where people who are living with mental illness can go and be checked by the healthcare professionals. Na even after the assessment, mtu akishajulikana ako na mental illness aweze kupata the right care so that it can help us, ndio tusifikie ile level ama ile point enye mtu anafikiria kujitoa uhai. So before we reach that point, at least let's have some accessible, tulete hizi healthcare services za mental health ziko even in our dispensaries where someone can go and talk about their issues. Tukuwe na counselors wakuwe very close to the people so that it's something which is very primary. Kwa hizi primary care, primary level hospitals like the dispensaries, and the health centers, the sub-county hospitals, tukuwe na hizi spaces and we have these clinics where people can go and find care, watibiwe, wapewe madawa, isikue like, let me use an example of Bungoma County. One would have to come from the interior to come to the Bungoma County Referral Hospital so that they can get help, and that is treatment, but there is no inpatient services for mental health services. So if we had this care which is closer to people, tuseme if I am coming from a village where there is a dispensary, kukuwe na counselors hapo kwa dispensary, kukuwe na psychiatrist at least visits once a week so that people can get that care and treatment, watibiwe hiyo once a week, and those who need therapy wako wanaona counselor, a therapist pia hapo hivyo kwa hiyo health facility yenye iko very close to them, that's a dispensary or a health center, that will help people to get the treatment, kushinda mtu afikirie kutafuta fare kutoka tuseme Mount Elgon, and there is a very big space, length ama distance, very long distance from Mount Elgon to Bungoma County Referral. So mtu akifikiria kupata hiyo fare kwanza ndiyo akuje, some are living in poor conditions, so they will not have access to care. But if we had a psychiatrist in Mount Elgon Sub-County Hospital, you see, care would be near them. So kufika, kutafuta the little that they can get for consultation and even for medication would be an easier burden than also looking for fare to travel to Bungoma County. So that's what I was making. And then also I'm talking about proper funding. This is also another approach that we can use. Proper funding to ensure significant investment in counseling, rehabilitation, and aftercare services so that victims receive accessible, affordable mental health support. So, talking about funding, I've seen the government look for sponsors and funders and even other countries coming in to help us with patients who are living with HIV and AIDS. And we are also looking at mental health as something which as a condition which has grown, and right now we are looking at 1 in 4 people being sick. So if 1 in 4 people are being sick, that means a large population is sick, and we're looking at 1.9 million as a number that WHO has given for Kenyans who are living with depression, and those are the only ones who have been diagnosed with depression for the numbers that we know right now. So kuna wale ambao hawajajitokeza, hawajui, but now if we got proper funding na tukue na clinics like the HIV, wakifika wapewe, waende kwa comprehensive care centers huko, watapewa madawa sometimes free of charge or at a fee yenye imekuwa imereduciwa, zimekuwa waived kiasi, some bills have been waived ama zimekuwa subsidized. So if we had government either funding or reducing the amount which is supposed to be paid for the medication and even for care for people who are living with mental illnesses, ingesaidia sana, because people would come out and because it's affordable they can get the help. So we are looking at counseling, tuko na counselors wenye wamelipwa na government so that wasaidie people who are living with mental illnesses. We also look at rehabilitation centers. Hizo rehabilitation centers pia because they'll be funded by the government, or if we get sponsors to fund the rehabilitation centers, we are also looking for healthcare providers who have qualified to deal with people living with mental illness, so that wasikuwe treated vibaya, wasikuwe harassed, wasikuwe wanafungwa, because people do not understand their journeys. But once we have the healthcare professionals who are qualified and committed to work in these rehabilitation centers, which are fully funded or which healthcare professionals are paid well, I think the care itakuwa better. We are looking at aftercare services. This is now after you've been maybe to a hospital, umeenda kwa rehab, if not a rehab, tuko na clubhouses within in our country and even in the county which I am, which is Bungoma County, and we're also looking at hizo care zenye, okay, if I was with a psychiatrist who is giving me treatment and my aftercare services is therapy, or the caregivers who are looking after me, or the community health promoters who are going house to house and giving the aftercare services from hospital to homes, home to house, because they visit people from house to house. So wakinitembelea and they have been paid well, or they have been fully funded by an organization or by the government, I think tutakuwa na better space where people can speak up and bring out people who are living with mental illness na wapate treatment. Another thing, and which is key, is to reduce stigma and engage in targeted public awareness campaigns to educate the community on mental health. So, stigma, unajua, in our country and even in our community, people are looking at mental illness kama urogi, ama mtu amelaaniwa, or it is a punishment, and sometimes they'll stigmatize that person or even the whole family which has a person who is living with mental illness. So if we had public awareness, we could try and we could try and create awareness around mental health and educate people that people who are living with mental health, that is depression, anxiety disorders, bipolar mood disorders, we're talking about schizophrenia, we're talking about all aspects of mental illness. Tukienda huko nje na tuanze kuambia watu ya kwamba kukuwa na mental illness ama ukikuwa na mgonjwa mwenye ako na shida ya kiakili ni ugonjwa kama ugonjwa zingine hizi, si kwamba amerogwa ama amelaaniwa ama ni kichapo kutoka kwa Mungu ama from a supreme being. Hao watu watajitokeza na waende watibiwa. Ukiwa explainia ya kwamba mental illness is just a disease or an illness, like a person who is living with diabetes, they live on medications for the rest of their lives, or for a long time in their lives, mpaka time yenye watakatazwa na daktari, ama for the rest of their lives. So it is the same thing with mental illness. Si ati ni mtu amepanishiwa ama ni mtu sijui ati amerogwa ama amelaaniwa. Ni ugonjwa ambao unafaa ukubalike katika society yetu, so that watu waweze kutoka nje na wakapate support. Yeah. So we also look at support associations or organizations, and I'm looking at one like the Crime Journalists Association of Kenya, which has been running a biannual mental wellness day, providing a safe space for journalists to come out and share their mental health struggles while in line of duty, as well as access mental health services while coping with trauma. You see, our journalists, when they go out to cover news, sometimes wanapitianga situations which can be traumatic. Like you're moving, like, let me use like the Gen Z maandamano enye walikuwa nayo in the middle of last year. Yeah. So if we look at that, and there is a journalist who is coming to cover that news, ama kama ile time ya Dusit D2 attack, ama like the Dusit D2 attack, the journalists who came in, they were covering news, na wengine walikuwa affected directly, or those who were even covering ile time ya bomb 1998. So kuna wale wenye wakuja kuchukua news and they are in a very awkward position, kwa sababu sometimes you need to cover the news and you are also going through the same enye wale victims wana go through. So you become a victim who is a journalist. Sometimes they need space to come and talk about what they see and what they go through in the field, so that ni kama kudebrief, unatoa and you also seek care and therapy, counseling, so that vitu zingine zikutoke, because once you keep piling 1, 2, 3 events in your head, sometimes kichwa inaweza kachoka na brain yako ikakuwa mgonjwa. So the Crime Journalists Association of Kenya, yeah, it has come up with the biannual event. Twice a year wanakuwa na event enye the journalists come debrief, wanaongea about what they go through, and also they have access to mental health services, yeah, which is helpful. Another way we can come up and help the mental health fraternity is the law enforcement officers and healthcare workers to receive training on how to identify and support individuals who are at risk of suicide. So there are people who will come, maybe it's a law enforcer, wamekuja wameshtaki ya kwamba kuna mtu mahali fulani mwenye amekuwa anajaribu maybe kujinyonga ama amekuwa anajaribu kuchukua uhai wake. So when someone comes and says that, the law enforcement officers should also be trained so that they understand this is a person who is sick and treat that person as a sick person so that they get the best referral, wapelekwe kwa hospitali ama to a psychiatrist whom they know, na akaweze kupewa services zenye anahitaji. Even the healthcare workers, sometimes someone is brought in and you do not understand the signs and the symptoms that they are presenting with, but if they got the right training on mental health, on mental illnesses, so that wanaweza waka identify this is a person who is suicidal and this is a person who is maybe going through depression na anaweza akafikia hiyo level ya kuwa suicidal, so that they help them get the right service, waweze kumrefer to the psychologist akaweze kumpatia therapy sessions so that asifikie hiyo kiwango ya kuchukua uhai wake, ama kama wanaona ni antidepressants anafaa pewe, this is a person mwenye wanaweza wakarefer to a psychiatrist na akaweze kupata the right help. So our healthcare professionals and the law enforcers, they are the first people sometimes who get in contact with such cases. So the right training to them, and additional training also will help them to identify people who have suicidal thoughts and those ones who are sick of mental illnesses, ndio wakaweze kupata the right support. Then the approach should embrace empathy and referral to appropriate care. Yeah. So you look at a person as, you look at that client of yours who has come to you, and let me say ujieke kwa hiyo kiatu yake, or think of them as being human and being sick at that point, and help them to get the right help. Help them to get the right help. Help them to get the right support. Wasaidie wapate the right care that they need at that time. So if you're empathetic and you understand that this person is trying to take their own life or is sick, but the underlying condition is this person has a prolonged stress or ako na mental illness yenye anafaa kushughulikiwa, so the best approach would refer to the right care, to the right professional who can help them. So, and that is a psychologist and a psychiatrist. I'll keep repeating this mpaka tuweze understand. And also we can take them either to a rehab sometimes, and our rehabilitation centers pia need kufanyiwa retraining so that they understand that someone who is going through this needs love, care, attention. Maybe ndio kitu imelack, and that's why they are contemplating kuchukua uhai wao. But if they got the love, care, and the right support and the right professional support and care, maybe hangefikia hiyo point, or to reverse the situation. So the best referral is giving, if you do not understand what the person is going through, refer to the best practitioner who can help. So the legislative arm also, that is our parliament, must ensure that the penal code aligns with human rights standards, with laws and policies enacted to support individuals with mental health conditions, including funding for mental health facilities and personnel. So having said this, our parliament, wabunge wetu wakati mnakaa mkitengeneza the laws and policies that are going to affect the health care section, kindly remember that these people are sick and need help. So, and when also disbursing funds, kindly remember that mental health is also a section in the health facility, in the health sector that needs help. So today we've been talking about the attempted suicide and understanding that it is also a sign that someone is sick. So let's give our clients the best help that they need, and also advise them or refer them to the right support that they need, so that wanaweza wakapata the right treatment or right care. Kindly don't forget to subscribe to my YouTube channel, like, share and comment pale chini, so that we can move together na tukaweze kusaidiana again and again and again. Otherwise, bye and have a blessed day.